Good morning and welcome. I'm Dean Miller, the President and CEO of PACT, and I want to welcome you to our Digital Health Series. This morning, we're going to be talking about how technology may play a role in solving pressing problems in healthcare. And we've got a great panel to discuss that, as well as some breakout rooms. I want to first thank and recognize our sponsors, without we could not do this. Blank Rome, Dwayne Morris, and Independence Blue Cross, very dedicated to the healthcare space, and we're grateful for their participation and their support of PACT, and in particular, our Digital Health Series. As you know, you're muted, but you can ask questions, so please use the comments box, the chat box, to do that throughout. We'll monitor. At about 9:35, actually maybe at 9:45, we're going to make sure that we do some Q&A in advance of that, but then we're going to flip to panels, and those will get introduced in terms of topics. You can choose your room and enter those. And so with that, what I would like to do now is introduce our moderator. Todd McQueston is the General Manager and an investor at Thesus Health, and welcome, Todd.
Todd, you're muted.
Oh, there you go. Hi, everyone. How you doing? Thank you, Dean. I apologize for that. I thank you for coming on this fine and, at least in Philadelphia, somewhat rainy morning. We have a fantastic show today, and let's get right to it. I first like to introduce Scott Brown, Managing Director of the Metaverse Health Lead at Accenture Health. Scott has an expertise in a wide variety. For today, where he's going to talk a lot about how technology like VR, XR, and other things can help with patient engagement. Scott, would you like to introduce yourself?
Good morning, everyone. Thanks for your time. As Todd mentioned, I'm a longtime health consultant at Accenture. I've spent the last 20 years looking at various innovations. Certainly at Accenture and I guess across the health ecosystem, we all strive for improving patient access, experiences, outcomes, and affordability. We're in a very pivotal time here. A lot of innovations over the last couple of years, but also we think we're in a little bit of a crisis, and there's this emphasis for how we reinvent the way that care is delivered. And certainly emerging technologies like Metaverse, we think, can help with that. So happy to share some perspectives as to how that can apply to the discussion today.
Thank you, Scott. I appreciate it. We also have Dr. Pierre Russo, Chief Medical Officer of Eversana today, but has a long history both in practice and both payer and provider spaces. Piero, would you like to introduce yourself?
Yes, good morning. Again, I am the Chief Medical Officer for Eversana, which is a life science organization with a national and international blueprint. My expertise is in cardiovascular medicine and transplantation, digital medicine, machine learning application in healthcare, population medicine, health administration, and health economics and reimbursement.
Thank you, Doctor. We also have Tracy Wilson-Rossman, founder of Journal My Health, as well as a lot of other things that she does for patient engagement and ensuring that the person is at the center of healthcare. Tracy, how are you this morning?
Doing well. I didn't have to drive to an event today, so that's awesome. At least it's not snowing. Good morning, everyone. Hi. I'm here representing the patient, and through my experience of unfortunately having a chronic issue, and also using my background in technology, really trying to have a better understanding of how to use the tech and our data that is available from us. How do we use that to the patient's advantage, but also understand how the healthcare ecosystem can use that as well. We believe that there is a place where both of those areas come together. It's just about viewing it in different ways. So there's a lot out there for patient advocacy and patients advocating for themselves with their loved ones.
Thank you, Tracy. We'll get into all of that this morning. Finally, but not least, I'd like to introduce Artie. He's the CEO and founder of a data integration and patient engagement company. Artie, tell us a little bit about people and data.
Great. Thanks so much, Todd, and for PACT, and for all the amazing colleagues on this panel for having me here. My name is Artie Arianpour, and we founded SEQSTER in 2016, just on a premise of putting the patient at the center of healthcare so we can disrupt all of the data silos that exist for patients. I come from a very heavy data science and genomics background, having built 2 major companies before. This is my 3rd company, and we never thought that the tailwinds would be behind us with SEQSTER now as it is, because everyone's talking about patient centricity, everyone's talking about controlling your health data, everyone's talking about how you do this, but we've actually built it. We innovated a technology that is helping, lots of different types of patients. I'm really excited and sharing some of those use cases and examples. And in the chat, I'll give everyone actually free access to our operating system later today. Thanks so much for having me here. And one last thing, congratulations to the Philadelphia Eagles. If you're a Philly fan, this is perfect timing to congratulate everyone for winning the game on Sunday.
Yes, Artie, we've done everything we could to not wear our Phillies gear for a non-Philadelphia like yourself. So I appreciate that. So listen, we have a lot of things to talk about, but the bottom line is helping people stay healthier and live longer using technology, data, and machine learning. Tracy, let's start with you. Talk a little bit about the ultimate goal for using technology to better human health.
Wow, the ultimate goal. I think that the ultimate goal is sometimes it's not about diagnosis, but of course, in fantasy land, we would be able to get diagnosed and treated with the right medication and the right treatments within 5 minutes of understanding that you have an issue. That's fantasy world, and that's not what happens. Me personally, it took 3.5 years to find a diagnosis, to get on a treatment plan. And guess what? My life is never, and for most people with chronic issues, you are not going to have a full-on recovery. We like to call the final phase is maintenance. And it's something that we deal with all the time, whether it's medication treatment or just changes because of the way that your body changes. So what we really need to strive for, in my opinion, is just a better health outcome. And a better health outcome is going to mean something different for everybody. And I'll give you a quick example. And again, I'm going to get really personal here. One of the issues I have is being impacted by weather. Even though people think it's a wives' tale, if you talk to anyone who has a chronic issue, weather is a definite factor. Well, on Sunday, and it's been a very challenging January, even though we haven't had snow here, with a lot of changes in barometric pressure. And Sunday was a particularly bad day for me. And I looked at the weather. I was like, it says it's not going to rain. I can't understand this. But, I popped an Advil, and half hour later, if everybody remembers, it rained here in Philadelphia. It was a little bit, but there was a definite barometric event that happened. I think that in general, the better health outcome is one understanding of what's impacting me. It's not just symptoms are an indication, but they're not always the root cause. And I think as patients, we have to be able to express and really not just have like a throw off anecdotal story, but to say to my doctor, it's been happening over a period of time. So we're giving them more information, a fuller story. And then, the other piece of this is knowing that doctors don't always have the time to spend with us. So that's something that we also need to understand as well.
Thank you, Tracy. So looking at that and looking at the ultimate goal, Artie, given where Tracy has led us, is it realistic to think that we finally have the AI ability to make this world happen?
Yeah, I think there's a lot of confusion out in the marketplace with lots of different, I would say, jargon, right? I'm sure everyone knows what AI is, but I bet you that most people here and even on the call don't even know what AI is. And why I say that, because it's a lot more complex than thinking it's artificial intelligence. Other than the things that are being said around, I guess, Chat GPT, before Chat GPT, the consumer didn't really understand what AI is. I think there's been a lot of buzz around AI, and for sure 2023 is one year where you're going to see artificial intelligence really explode in ways on the consumer side that you hadn't seen before. But on the expert analysis, business side, medical side, technology side, there's been various tools within AI that have been created that can have better use and help physicians, help patients, help the community with assistance, I would say. That's the way I look at AI. But I still think we're far away from actually AI being really usable and dependable. It's more of a mini tool, I would say, right now. That being said, there are various different technologies that have nothing to do with AI, but have to do with data aggregation, that have to do with standardizing and harmonizing data that are out there. And this is something that, my team and I have spent 100,000 hours working on in the past 7 years. And if everyone is familiar with bringing together your banking information, like your Wells Fargo accounts, your Bank of America, your Chase, your Capital One credit cards, maybe you have some student loans and you want to see what your net worth is, something called Mint really paved the road on the fintech side for things like that and got that out to the average person or consumers. And now millions, tens of millions of people utilize that sort of technology to look at their banking data. Now, imagine if from a patient side, you can look at all of your health data and see your net health data. How do you bring data from, Fox Chase Cancer Center over with your UCSF data to your Memorial Sloan Kettering data to your dermatologist that's, in the middle of Arkansas because, you lived there for 2 years during COVID, whatever the situation is. Most people by the age of 25 have at least 2 providers. Most people by the age of 35 have at least 4 providers. Most people at the age of 60, if they moved around, they have 5+ providers. And if you're a woman, you have multiple different specialists. You've always been used to going to OBGYNs, and you have all different sorts of data everywhere. And then if you are a patient, say you're a cancer patient, like my dad was, and we'll talk about that later, you got 8 different providers and lab results from everywhere. So how do you bring all that data together? The hospital can't do that. The physician can't do that. And so the patient has to be empowered in order to do that. They're best actually positioned to do that as long as you give the patient a technology to do that. And so with SEQSTER, it's all about seeking health data. So we created the mint.com of your health data for you to be able to do that. And there's various different use cases that that helps not only for families, patients, and caregivers, but for clinical trials and, you know, lots of different things with.
Artie, you clicked on to mute.
Oh, weird. In 2016, none of this was possible, but now it's definitely possible.
Thank you, Artie. I appreciate it. As an old time HIS person right out of college, we've been talking about putting data together to help the patient for decades. And it's interesting that we finally feel at this moment in time, we are at the precipice of actually being able to do that in our capitalistic society. In addition to the patient, though, machine learning and putting AI together obviously needs to help the clinician as well. Piero, tell us a little bit about personalized medicine and where machine learning can go based on what Artie just said.
Yes, I'm going to try to give a unified vision between what I heard from Tracy and what I heard from Artie. The precision medicine, as defined by the NIH and understood in population medicine, is the offering of a care delivery system that taking in account the patient unique variability, whether they are genes, environment, response to the environment, social determinant of health, patient history, patient specific physiology. And so the goal of precision medicine is to offer a care delivery system that identifies the right patients for the right treatment at the right time. But how do we do that? Well, I think that the availability of big data, the ability to collect data, and the ability of using digital medicine today allow us to get closer to the goal of precision medicine. What do I need for precision medicine to reach that goal? I need to be able to obviously make prediction, identify trends and patterns between the data. But I need to collect that data, right? First of all, I need to collect that data. Then I need to analyze it. And again, machine learning allow us to do that because through mathematical algorithms, we are able to essentially identify what the data tell us and with minimal human intervention. Then the machine learning can inform some of the automation that we are using in clinical practice, and we'll discuss this later. So the actual that nexus of forces that is digital technology, digital medicine, which is really the integration of digital technology with AI and machine learning, allow us today to collect the data, analyze the data, make sense of the data, and then deliver a more efficient system of care, which is more personalized and, most importantly, make access to care easier.
Thank you, Piero. Interestingly enough, we've been talking about putting data together, like I said, for decades. The theory here, Scott, is we have an idea that we are taking AI, interpreting data, giving personalized information to the care team, responding to acute issues and chronic issues. But from a technology perspective, how can technology help us bring that data together and give us a view of the everyday needs of people to ensure their most healthy self?
Yeah, I think one thing that's important when we talk about the data, and I'm going to use, when I say the term AI, I'm going to, back to Artie's comment, I'm going to say applied intelligence, not just artificial, but lots of different use cases. And we can talk about ChatGPT later. I think it's important to think of the data as not just your health data also, it's also your personal, who you are and how you like to interact. And situational, you mentioned the acute issue versus a chronic patient and the level of education. And if we've learned anything from the pandemic, we need to meet people where they are. And so that means hybrid care models and different levels of engagement. Interoperability and giving patient data, certainly we've made progress from a standards perspective, but we're by no means in a place where people actually have access to all their data yet. And even if they did, it would be overwhelming. And so how do we leverage AI? One of the holy grails we talk about, we use this term over and over again, but it's actually really hard, is next best action along a care journey. And that next best action is something that applies both to the physician as well to the patient. Health literacy is still a problem. I've worked in healthcare 20 years. I go through acute issues every day. I just had one pop up yesterday, unfortunately, with my mother-in-law. I'm texting doctor friends, but imagine the average consumer and navigating this process. And so certainly there are lots of different applications of AI that can help to improve the patient experience. Patient education is one in particular. I think about, I love the Chat GPT and creating the Chat GPT for a patient education, right? There's also, as we think about upcoming issues with the clinician crisis, how do we eliminate some of these, what I'd call pretty standard and things that have, are pretty standard pathways of care, and get that education into a standard model that we can deliver at scale. So lots of, as you mentioned, lots of different applications of AI. And at the end of the day, whether it's supporting a physician along, helping a patient along their care journey, the patient themselves, the caregiver, we need to not just apply them the data, we need to apply them the explanation of what they need to do with that.
Right.
So it's interesting. I've heard all four of you now talk in various ways about the fact that we, at the end of the day, we're in a capitalistic society where our data is scattered. I feel like I'm a professional, educated person, but to get a hold of my entire health data, both from an acute care, chronic care, and as well as a wellness situation, I have 20 different places I have to go.
Yes.
I have 100 different sources to explain conditions to me. Do I really want all of that data? And how will I even be able to understand it if I put it together?
So, Todd, that's a fantastic question. And I think, one of the things that we're looking to do at Journal My Health is there's so much data out there, right? So there's data that's held by the healthcare system, your tests, your doctor's appointments, but then there's the everyday data that impacts you. And I had a call recently with someone on the pharma side, and she brought up this really, V8 moment, like duh type of realization. From a patient standpoint, you see your doctor for a small amount of time. If you're, and I'm talking about somebody who has some issues, right? You as the person are managing yourself 99% of the time, unless you're in the hospital. So we have to think from the patient standpoint. And I've had this conversation around patient engagement as well. There's patient engagement that's coming from the healthcare system and the way that they view it. And there's patient engagement that is coming from the patient standpoint, the person, the individual. So how do we meld both of those views together? And then that brings into the conversation around data. So there's definitely data that can be viewed from the healthcare, from your tests and things like that. But then there's that everyday data that I'm talking to people with chronic issues and they're managing 5 or 6 different spreadsheets. So how are we bringing that information together so that they can view it in a way that makes more sense for them? So there's lots of different things that we need to think about around data. And it's not just from, your tests and your medical records. I think that there's a lot to be said about how we're engaging the patient. We're just one last thing, Todd, I'm sorry to monopolize a little bit, but we're in the middle of having a survey of people who have chronic issues. And are they journaling? Are they keeping track of their information? And also, if they're not, why? And one of the pieces is that they think it's going to take a lot of time. So we need to design systems that are going to that are human designed, human-centered design, and take in consideration of how somebody, an individual, is actually going to interact with whatever we're putting out there. And sometimes we forget about that. So
Interesting, Tracy, that the thought process and collecting data, we have traditional claims data, we have the EMR data, et cetera. Knowing that we won't have perfect data, Artie, how do we respond to Tracy? What can we do to make people's lives easier?
I think it's a bottle of scotch and, like, 2 cases of wine conversation, and we have to have a packed party to really, unpeel the onion here that Tracy mentions. Yeah, look, what I love about what Tracy's stating is she's talking from the patient's view, right? And I think a lot of companies, a lot of technologies, a lot of engineers, they just think from the engineering view. And that's been, in my 20 years of experience, the real big problem. Providers are the problem. The healthcare system is the problem, ladies and gentlemen. I don't need to tell you that. You know that. It doesn't matter if you're a patient. It doesn't matter if you're a professor. It doesn't matter if you're a physician. It doesn't matter if you are an entrepreneur. At the end of the day, you are a consumer. And you are a consumer first before you're a patient. You only become a patient when you become sick. We only care about our health when we are sick, unless you're some innovator that's crazy into data and you want to see everything and, grind through it. But most people are not sophisticated bioinformaticians that can actually grind through data. So we have to, as innovators, as patients, as physicians, as, folks on this call that are leading different initiatives, empower communities, not just patients, to collect and own and share their data. And that changes the whole dynamic. And so, this isn't something that one company can do. This isn't something that one patient can do. This isn't something that one government can do. Our taxpayer dollars built Epic. Our taxpayer dollars built all the EMR systems, and they silo the data. However, at the same time, they help physicians and patients actually get better care at the same time too. A lot of people see, those companies as the dark side, which they kind of are, but at the same time, they're there to help you the same way that people view pharma companies. Oh my God, they're coming out with another drug. Well, if pharma companies don't exist, then we're all not going to be able to live healthier lives as well. So I think there's a cost to being a patient. There's a cost to doing business, and there's a cost to having education in the right way so that you can see all your data in one place in a full longitudinal format that's easily readable as well as shareable. And, there's lots of work that needs to be done there within collaboration, but it's a very long discussion. I'll stop right there.
Thank you, Artie. And again, the thought process there is we know we have disparate data. I don't believe at the end of the day, there's anybody on this call who doesn't realize that healthcare is one-to-one, consumer to the provider. So Dr. Russo, the thought process of putting this disparate data together, doing the best you can from a provider standpoint, a clinical standpoint, tell us how we can make the consumers understand what's going on. And oh, by the way, what technologies are out there that help the provider move forward in this issue that we have here.
I like to offer a more positive view in that I like to share and remind everyone of the progress and the successes that we have been having. For example, the current digital front doors, there are many. right? So it's defined as the digital connection between provider and physician do exist, right? I mean, ARDIS platform is a digital front door that collect all sorts of data, from genomes to clinical data from electronic medical records. There are plenty of case management, virtual case management platform, which are digital front doors that collect all that data. Let's not forget that you can get an EKG from your Apple phone or from some available $90 platforms that you can buy on Amazon. We have made a lot of progress in utilizing AI to improve the accuracy of colonoscopies. I discussed this with Ardit because of his father's situations. The human beings, even the best possible GI doctors with a lot of experience, still miss polyps that can become actually cancer within 2 or 3 months. However, there is plenty of evidence that AI-driven colonoscopy reduces that risk to a minimum. The Mayo Clinic has plenty of experience with that. Those are success stories that we need to obviously augment, right? But are there. Again, I don't want to cite specific brand, but insurance companies are using virtual case management that interact with the patient and allows the patient on a daily basis to provide their symptoms and signs. And a nurse eventually show up on a video and discuss the problem. We have ways to collect wearables data directly at the patient site of care. We have electronic weight scales. We have blood pressure monitoring, continuous monitoring, right? And actually, the insurance company, case management companies are using this technology to interact with their patient. Text messages. When I was at Independence Blue Cross, we used text messages back 10 years ago to attract the attention of the patient, to communicate with patients, right? So these are success stories that we should not forget.
Thank you, Piero. Appreciate that. Scott, think about what Piero just said. What is the importance of integrating these experiences versus just worrying about collecting the data and trying to analyze it?
Yeah, I would just add to what everyone's been saying, but to your point, it's great to have all the data integrated. That's foundational. But to the end consumer, patient, caregiver, how we integrate that into the experience. I think there's like 40,000 different health apps in the App Store. There are 100 million smart wearables coming out by 2026. All great, but at the end of the day, to the consumer, how do you take your interactions with your payer, your provider, your multiple providers, comorbidities, the intersection, we use terms like whole person health, your mental health, and all the various elements of all the great innovations that have happened over the last few years in digital health, and integrate it to one experience. That's sort of the nirvana. And we're starting to see that. I'm starting to see my clients, payers, providers that are looking at, I'll use the term digital front door in a different way, but how do I take all these disparate experiences and pull them together with a foundation of the same data so that we're seeing the same things, we're sharing experiences, and it's easy for the member, but it's hard and it's a journey. And there's not like a single technology that like solves the problem. So you have to do it in waves, strategically, crawl, walk, run. How do you, if you were to look at some of the largest healthcare companies in the world, you've got payers, providers, retail health, retail pharmacy, specialty. There's so much information. And even just for those companies, just to connect even two parts, right, through their integrations or acquisitions and M&A, So it's definitely a journey, but I think at the end of the day, the data is great, but you still need to know how to, it ultimately to a patient comes down to the experience. And that's truly what's going to build trust and trust in the system and loyalty, because patients are also switching it at incredibly high levels these days, particularly the next gen.
Thank you, Scott. I appreciate it. To the people on the call, just as a reminder, we will have a Q&A session at the end, but as we walk through this process, feel free to put your questions in the chat or follow-up topics that you want to talk about. So to the whole panel, at the end of the day, we have disparate data coming together. We finally have the technology, we think, to put it all together, analyze it, move it together. But if we look at it from a different point of view and realize we're US based discussion here, knowing that we have Medicare and Medicaid that are now 50+ years old, you look at all of the data that is out there about, as a country, are we any healthier? The answer is
No.
not really. So the last 50 years, we're not really that healthier. What is it about today? What is about the technology, the growth, where we're going today that makes now the time we have to take advantage and finally try to start getting over the hump?
Well, I think today we have better opportunity for education of the people of the patient, right? Exactly using the same technology that connect people with each other. So you know, there are again case management organizations, population service organizations, even insurance companies are using Facebook. Text messages, the telephone to try to connect with the patient. The key is to, there is no question that the healthcare system in this country, obviously double perspective because in the early days I practiced in Europe, but the point is that of course our healthcare system is being based on acute care, not on healthcare, right? So we provide an excellent acute care, but we are unable to create environments that allow people to walk, to use the bicycle, right? I mentioned many times people in Europe are forced to walk because they are closing some of the center cities to traffic. We don't walk. We have part of the problem with the pandemic was a large amount of people with obesity. That, of course, was a risk factor for the complications. So we absolutely have a problem with understanding how to prevent, but clearly today we are making progress because we are able to connect with, we have the technology to connect, and we have the technology also to predict. For example, how many of the 20,000 patients with hypertension we are able to identify specifically the patients who are going to develop heart failure. And those patients will need something as simple as remote monitoring of their blood pressure. Think of continuous glucose monitor for diabetes. We are able to control those patients much better today with continuous glucose monitor. So we have the technology and we have actually the will. Unfortunately, there is a switch in culture that again is pushing for precision medicine and a access to preventive medicine and education of the patient.
So Todd, I think that there's a piece that we're not talking about, and I don't want to take us down a path, but there's definitely an issue that we need to discuss, which is around equity. And coming at this from, you know, how we are managing women's healthcare and those in underrepresented areas. Women represent over 50% of those who have chronic issues. Yet the amount of dollars that are going into working towards just women and their healthcare issues is very small. And for those of you who are on the call, some of you may know this, but for a 16-year period, women were not included if they were of childbearing age in FDA studies because of menstrual cycles. So there are things that we have to, we have the technology. We've got interoperability. We've got to think about equity. There's many, many pieces that have to come together. And I know that I've sort of hit a lot of areas, but I think one of the other issues, yes, we have to have the patient and the healthcare providers really, I hear story after story of of information being brought to the healthcare provider and the healthcare provider maybe not taking it seriously, maybe not understanding the importance of the devices that we're bringing in. I've heard many, many times from doctors, and I'm not here to like slam doctors, but the digital devices, they're not, they don't feel are accurate enough. So there's some I don't know if mistrust is the right word, but I think for us to have more of a healthy United States population is also this communication that has to happen between patients of, no matter sex or gender or economics, and their healthcare provider. Those healthier conversations happening, I think will make a difference.
Thank you, Tracy. It's interesting looking at my own personal situation. My 87-year-old mother, my father passed away, but that generation, the doctor was king. I don't think it's an either or at this point. I like to look at it more positively. I would just say, starting with the baby boom generation on down, we are now used to having technology in our hands. We're used to trying to figure out the information ourselves. And we get frustrated if we don't understand what the information means, and we have to call the doctor, the NP, or somebody else to explain it to us. So I think from that standpoint, we can look at the idea of whatever disparate information we have, knowing that there's inequality, like you said, throughout there, still actually open up people's ability to use the data and to have the data there. Artie, what do you see as the basis for moving forward, trying to close out the inequality that we have today?
Yeah, I love what you and Tracy said. I'll try to combine what you guys said for the audience, because I think there were some tea leaves in both your guys' discussions that relate to what I'm about to maybe shed some light on. So I absolutely agree that, women are the mothers. Women are the ones that tell men to go to the doctor. Women's health, I spent 15 years in women's health before starting SEQSTER, specifically within breast and ovarian cancers. And I can tell you one thing that we saw looking at millions of samples, millions of genomes, was that there's no better army for healthcare than a 46-year-old woman. It's amazing, right? And so, but I don't want to turn this into men versus women, but at the end of the day, I think that what Tracy was trying to, talk about is really important, because a lot of companies, a lot of communities don't spend not enough time actually listening to women on how healthcare should be. I'm not saying men don't know how healthcare should be. I'm just saying women are more in the trenches of healthcare because they have multiple visits, multiple providers. They go see and do their physicals and see their OBGYN at least once a year, if not 4 times a year. So they have more experience than anyone on this planet with medicine. That being said, I do think that what you said, Todd, about the last generation, our parents' generation, medicine was different. And you have to understand that the United States is now 300+ million people. It's a big cohort, right? And so it's really hard when you layer that in with interoperability and, 150,000 providers and so forth. Europe doesn't have that. Asia doesn't have that because the UK doesn't have that. They have one system, the NHS, and it serves 70 million people. And so the way that the US has been built within 50 states is a spider web. And telemedicine in COVID showed us that we should be going back to the 60s and 50s because the doctor should be coming to your house. You shouldn't be going to the doctor. And so it's not about just future technologies. It's applying those things that we've learned in the past with technology to advance all the things that Piero was saying about, hey, look at these success stories. You got wearables, you got Apple Watches, you got, Dexcom blood glucose, devices. You have genetic tests that you can take on the fly online. You got various different apps that can help you with certain things. So there's a plethora of information there. What's missing though is education. There's no encyclopedia or school to teach patients and physicians how to use this sort of thing. So you have to go towards different use cases.
Great, Artie. I thank you. Appreciate that. Scott, given your background and thinking through the thought process of what we are all saying, what is the simple reason on why now, where we have to hit equality, where we have to realize we may just have the technology to bring the doctor or the nurse practitioner or the nurse back into somebody's home? Tell us why now.
Yeah, and I just build off of what everyone said, but maybe make it a little bit simple. Certainly there is we talked earlier about patients want a different experience. They want you to meet you where you are, the rising costs, but maybe to paint a different picture, supply and demand. We have an aging population, and we are facing what will soon become a very large clinician crisis. And we're seeing that for many reasons. There's less physicians in training. We're seeing burnout. I think in the next 10 years, we're going to be about 100,000 doctors short. We've already seen what's happened with nurses and the burnout. Certainly there's a way, but also many are leaving the workforce for various reasons through COVID. Pharmacists, saw an article the other day about CVS and Walmart cutting hours, therapists, shortage of therapists to address the growing mental health crisis. So I would just say that the biggest reason is we have to do more with less. So technology is certainly, that's how we think of technology. It's not instead of or of the clinician, it's human plus machine. How do we more effectively use technology to provide better care and supplement physician care so that they can spend the time on the things that matter, being empathetic to the patient, educating them, providing the right level of care?
Yeah, and I agree. And actually, just a quick comment. One example of how to use resources better is the hospital home model, where acute care can be provided for certain patients who don't need to be in the hospital, in the home.
Absolutely.
It started with one patient in Boston in 2017, and now it is being utilized all across the country.
Yeah, that's great, Piero. I was going to go in the same direction, but for a different reason. Looking at acute care, hospital, home, absolutely. But think about the process of being at home alone. Again, my 87-year-old mom, 3 different specialists, 9 different prescription medications, wanting to stay at home for as long as she can, fell, broke her hip, now recovering from that, still wants to stay at home. The individual at home doesn't have any clinical oversight, and not so much that generation, but again, the stereotype a little bit, the rest of us have a penchant for not wanting to follow somebody else's directions blindly, but want to try to figure things out ourselves. How do we use tech at home to keep people healthy, to move forward? I do not want my 87-year-old mother to have 87 wristbands telling her all her different medication and monitoring devices. How do we look at this and realize that we truly are in a time now where we can help people at home?
So I think what you're saying there, Todd, real quick, what's really important, we haven't talked about it, is the caregiver. We talk about patients, but we haven't talked about the caregiver. And that's maybe we should have a whole session on PAC next about the caregiver. But I think what's really important is, how can a caregiver, a son or daughter, manage mom and dad's health, or grandma's, health, or grandpa's health, from San Francisco to New York City? And in COVID, again, this happened. This happened at scale in COVID. 300 million people were locked down in their homes, and we couldn't go anywhere. It doesn't mean that health didn't happen. It doesn't matter that heart attacks didn't happen. It doesn't matter that people didn't have seizures and cancer didn't happen. Disease doesn't stop just because, lockdowns got, instated. And so I think we all learned a lot about how the caregiver model is so important for not just medicine, but for families, for people. And you're absolutely right. Having too much technology is not good, because an 86, 87-year-old, man or woman is not going to know how to manage their health. But, if you can simplify that with one piece of software and maybe one major wearable that's for their, main condition, and that data then gets pinged and notified to the caregiver if they fall, if their heart rate goes up too high, or whatever the scenario is, that is a lot more than doing nothing. And we have to start somewhere, and we have the technology to do that today.
Yeah, and I would add two things. Number one, I would mention the model, which also is used at the University of Pennsylvania, of community health workers coming to the home, but also platforms. I've seen a demo this week of a platform that has telemedicine, has a carousel for distribution of drugs that the patient must take under supervision of the nurse showing up on the telemedicine video. And at the same platform can collect biometric data. The technology does exist. A community health worker can come and help that person to indeed utilize that technology. That model actually exists. And there are, again, I don't want to cite private companies, but I certainly cite the University of Pennsylvania as one of the best models for community health workers coming to the home and help with either regular tasks that the patient may need, and whenever the technology is developed, is delivered, use the technology.
So Todd, just one thing, I'll not to be, I guess, a Debbie Downer, but we talk about the technology, and I was at a conference recently, and people were on stage, very high level people, talking about the technology is here, which is great. I don't disagree with that. But I think that there's something that we also haven't discussed here, which is the cost of innovation. How are we paying for the innovation? And, there's a nonprofit model and there's a for-profit model. And how are we bringing all of this together? How are we fostering the innovation? How are we paying for it? How are we creating an ecosystem where there is interoperability, that we are working together, that no one person or company owns everything? So, I bring that up because that is something that we have to think about as we move forward, going down this path. And yeah, so.
And I think, that's really important, Tracy. It's ownership's a whole nother thing. Patients own their data. Companies cannot own patients' data. Patients consent to share data with companies and providers and so forth to make the world a better place. It's that simple.
So let's wrap this up. We're about to go to our breakouts in a couple minutes, but think about that, what you guys just said. Again, the caregiver of someone at home or the person aging at home for themselves. In certain areas, like the area I live in, I have technology in my home that can actually contribute to my healthcare. I have technology there that knows when I'm in a room and wants to listen to music. I have technology to see who's at the doorbell. I have even technology to let my wristband know if I'm lying in bed or not. Putting that person-based data and bringing it to someone, the caregiver, the in-home specialist, the son or daughter of that person living, that's definitely available today. The education piece is what I've heard over and over again, which is something that we have to continually simplify. I heard a great story from Scott the other day about using XR gaming technology, literally having people understand what their condition would look like and putting that together. Again, simplified, at home, aging market. Scott, where do you think we can add value to ensuring that the person who may own their data, may have some data, but the reality is they need to understand it? Where can we go with our technology today?
Wow, there's a lot there's a lot to unpack. So I'll just give a couple of different ideas and maybe to build off of just the opportunity. Certainly there is an equitable element across all of these things. To not everyone has the same access to tech, to internet, certainly, but as you even mentioned, the rural elements. And wow, we're at the end of the conversation. I've barely even talked about what I do on my day job, which is thinking about the metaverse and this next wave of the internet, and the internet of, we call it the internet of experience and ownership. And gosh, there's so many great use cases that we're already seeing in the senior population. Everything from how do I manage my pain, to how do I, and there's some, you guys can Google and look up some really cool stories of people, of seniors, and going to, like, revisiting places of old, all the way to educating myself on my condition. I used the example, I think the other day with you, Todd, of my mother-in-law just was diagnosed with Alzheimer's. What is the next year going to look like? What's the next 5 years going to look like? But all of that requires the enablement, the technology enablement, the equitable access. There's some great organizations out there who will power that for you in the home. But yeah, the opportunities to leverage emerging tech in this space for seniors and at home, whether it's mental health, physical therapy, pain, I think are very opportunistic, and I think the future is bright.
Yeah.
Thank you. We have just a couple minutes before we go to our breakouts. I'm going to ask Chris to introduce them in a second. But before we do, final words, Piero?
Well, final words is, again, I agree with Scott that the future is bright. We have work to do, but we also need to be positive and recognize what the integration of digital technology, data, and machine learning has been doing for the providers to be a better provider, a more efficient provider, connecting the patient with the doctor. Let's not forget, again, the use of telemedicine now for practically everything from telecardiology to behavioral health and telepsychiatry. The improvement in diagnosis that now help with simplify the process of reading images. We are working with a company, for example, that is connecting the patient history with the echocardiogram, and so build up the correct phenotype matching with the echocardiogram to automate the reading of echocardiogram and electrocardiogram. So, and I think that all of that, again, put us really closer to that precision medicine, that medicine that should take in consideration the patient preferences, but also where the patient lives, the environment, and the genetic, and of course, the clinical history.
Thank you, Dr. Russo. Tracy, what are your final words before we go to the breakout?
Final words is I believe that patient-generated data that is visualized in a way that is good for the patient and good for the healthcare provider is something that we should really be concentrating on.
Thank you. I appreciate that. So we will have breakouts. Before we do that, just understand that we'd like to stay here where these 4 experts are going to split 2 and 2. I absolutely encourage you to go in and go to the correct breakout to ask your questions that you have. Pac, would you like to make a mention of what we're doing?
Yeah, just to pop back on, thank you to our panelists very much for being here today. And thank you to our sponsors again as well, Blank Rome, Dwayne Morris, and Independence Blue Cross.